Welcome to Therapy Explained, where we explain, demystify, and destigmatize mental health and mental health treatment. My name is Deniss. I'm a licensed therapist, clinical director of a mental health group practice in California that offers therapy to individuals and couples throughout the state of California, and your host here at Therapy Explained. Today, as you may have already known and noticed, we're going to be talking about what to do when our brain keeps going to the worst case scenario. So without further ado, let's go ahead and jump to the video. Self-compassion. Now, self-compassion is the secret sauce at my group practice, teaching you how to be kinder to yourself, how to observe your behaviors and your patterns without judgment is what helps you create motivation towards your goals and helps you build on that momentum. But how do we build self-compassion? We hear it a lot, but don't really know exactly what that looks like on the day-to-day, so let's talk about that. Self-compassion is built by learning how to take a step back and doing what I call contextualizing. So really looking at a broader view of your experiences. When we're able to zoom out and contextualize our experience through the lens of understanding that we have an intersectional experience to our mental health, we can practice being a little bit more compassionate with some of the things that maybe we're not proud of and some of the patterns and behaviors that we don't want to engage in anymore. So recognizing how being a person of color or a woman or a non-binary person is affecting your experience of the world. How is that affecting your mental health? The way that the world interacts with you and expects of you versus what you expect of you and what you want for yourself and the kind of life that you're trying to build for yourself. So this piece, of course, always requires a lot of room and support in therapy, but if you can start to practice asking yourself that, what is the intersectionality of this particular behavior? Or in other words, what parts of my identities are playing into my experience, right? Whatever that might be. Number 2 is calling it out. Something that will help us with calling out what is actually happening is learning vocabulary. And again, this is something that is one of the key features in the kind of therapy that we do at my practice. And that is teaching you how to name the things that are happening. When we can name what is happening, it gives us a sense of control over the pattern and the behavior. If you're having a really scary thought, the only thing that we feel in that moment can be that overwhelming sense of fear. It's a scary thought. It's the worst case scenario. But if we can practice naming it, that kind of also gives us ownership over it. It's being able to say, I name you, so I own you, which also means that I have power over you and can do something about this. Right? So we're talking specifically about these behaviors. So learn the vocabulary. Worst case scenario in cognitive behavioral therapy is known as catastrophizing. So thinking that things will be catastrophic. There's also different types of negative and anxious thoughts, which are called cognitive distortions. And I have a whole video on that. So be sure to check it out if you want more information on what that is and the different types. But essentially, catastrophizing is a cognitive distortion, and there's different types. And what we want to do is be able to take a step back and say, okay, I'm catastrophizing because I'm anxious, right? And because I'm afraid, because I've experienced something similar in the past, which is a part of our mental health and a very important part of our mental health to keep in mind, that a lot of our fears are connected to past trauma or past hurt. So we're not coming up with these things out of nowhere. So if you're having some fearful thoughts, it's probably because you've experienced pain in a similar way and are afraid to put yourself in a similar position. The next piece is using it. While living in the catastrophizing thought itself is not the most helpful thing to engage in, sometimes using it can be helpful. If you're having a catastrophizing thought, if you're thinking of the worst case scenario, sometimes you can use that to plan for it. So if you're feeling anxious and out of control, the strategy could be, okay, if that happens, what are my resources and how can I help myself? Create that plan and then leave it. That way, when the worst case scenario comes up again, you can tell yourself, hey, I'm having a catastrophizing thought that is very rational and connected to my past experience, but I already have a plan if the worst case scenario happens. So now my next responsibility is just to take care of myself right now. Next is leave it. So once you've done your plan, you've actually used your catastrophizing thought to make a contingency plan, you can leave it behind. As I mentioned earlier, you can then start to self-soothe by reminding yourself that you've already addressed the worst case scenario and now you can take care of yourself. But how can we take care of ourselves? Learning to leave it behind, again, is helped by developing a plan, but the next piece means that you have to take care of your nervous system. Your nervous system is activated by the fearful thought, so now your responsibility is to take care of it. Engaging in coping skills like deep breathing, meditation, going for walks, or any other sort of coping tool that helps your body feel grounded can be a huge help. And the next piece of that is also creating affirmations. Because our brain's going to go to the worst case scenario, learning how to talk to ourselves in a compassionate, kind manner to help us feel more grounded and at ease is key. Thankfully, you can find affirmations all over Instagram, all over the internet, so you can also search Pinterest. You can create some of your own. If you have a therapist, you can also brainstorm some with your therapist that are specifically applicable to you as well. Now, a lot of these items on the list will take time and they take some practice. It's difficult to get ourselves to build a new pattern of engaging in these steps. So be patient with yourself, and if you can find a therapist or an accountability buddy, that can be, well, helpful in keeping you accountable. I hope that you found the video useful. If you did, make sure to give it a thumbs up, subscribe to the channel if you haven't already, and I will see you in the next one.